My name is Taylor Meserve. I am currently completing my field placement at Hurricane Elementary School. Hurricane Elementary School is located in southern Utah, where I am originally from and currently live. While I have been completing my field placement, I have had the opportunity to work with many different populations and a diverse set of students. Early on in my field placement, a team made up of the special education teacher, a behavioral technician, the licensed clinical social worker, administrative staff of Hurricane Elementary, and myself made the decision to create a behavior-based classroom due to extreme behaviors that were occurring within the school on a daily basis. These extreme behaviors had the potential to last up to 2 hours of the school day, thus resulting in a lack of academic achievement. The behavior classroom was created to help these students in order for them to have a successful rest of the school year. Once the behavior classroom was decided upon, the next step was figuring out what students would be the best fit and who would benefit from it most. As a team, we talked with administrative staff and teachers to gain their recommendations. Once recommendations were made, we reached out to parents and guardians of those students to understand their feelings on if they believed it was necessary. Although it was not voluntary for the students, it was completely voluntary for the parents and guardians to decide for their student. We had telephone conferences with the parents and teachers, as well as signed permissions for those students who would be participating in the classroom. The students who participated in this classroom ranged from 1st grade to 5th grade. The question that was continually utilized throughout the evaluation that was being conducted was, did the duration of the problem behavior decrease after the participants completed the 6 weeks in the behavior classroom? The problem behaviors that were occurring prior to this program were eloping out of the classroom, noncompliance, and extreme behavior outbursts that included yelling, screaming, hitting, and destroying school property. An intervention that was utilized throughout the behavior classroom program was the check-in, check-out intervention. The rationale for selecting the intervention was based upon the needs of the students and giving them the ability to set their own goals, all within a criteria of clear and concise behavior expectations. All of the students within this behavior classroom had an appreciation for their independence, and by setting their own goals, they had the motivation to achieve them. Having them create a goal at the time of checking in, and with them having the understanding of needing to accomplish it before the checking out time, gave them a sense of ambition for positive behavior. The check-in, check-out intervention is an evidence-based design that externalizes behavioral problems and overall emotional and behavioral risk. The features of this particular intervention include setting clearly defined behavioral expectations and a structured mechanism to provide feedback on the behavior. As stated in previous slides, this was a pilot program and first of its kind for Hurricane Elementary School. There were many different techniques, methods, and interventions being tried and tested. In my literature review section of my evaluation report, I discussed multiple interventions that have been proven to be successful, but for this particular program and this particular school, this seemed to have the highest rate of success. This has also been proven to be effective by a study done in May of 2018 that was found where there was an increase of positive behavior due to the application of this intervention, with this study being completed. There has also been a rise in utilization within a school setting continually. A systematic review that was completed on the check-in, check-out intervention in 2014 also revealed that there was a higher success rate of the intervention applied in elementary school settings rather than secondary education settings. A major key in a check-in, check-out intervention is providing consistency to the students receiving it, as is with any intervention being completed. The outcomes that I continually measured throughout the duration of the 6-week behavior classroom intervention was duration and participants' behaviors. These behaviors could and would include eloping, noncompliance, and destroying school property. Duration of these behaviors could last anywhere from 15 minutes and 180 minutes, in some extreme cases. I studied Colvin and Scott's 7 phases of acting out in order to base when I should start measuring the duration of behavior. The 7 phases are calm, triggered, agitation, acceleration, peak, de-escalation, and recovery. I made the conclusion to start collecting data and start the stopwatch once the participant entered into the agitation phase. This was depicted by seeing clenched fists, putting their head down on their desk, and/or making unpleasant sounds. Other physical signs would be flopping to the floor, and banging their head against their wall or a desk. Once I started my stopwatch, I would not stop the stopwatch until the participants were in a state of recovery and calmness. I documented the data that was collected in a Google Sheet in order to share the document with multiple people in our team and in our school. This allowed good observer reliability as I was observing the behaviors daily. This also proved to be effective when I was unable to be there and I had to have another person collecting the data. In this instance, our special education teacher or behavior technician would collect the data. A check-in, check-out sheet was also provided to the participants each morning. During the check-in, a goal would be written on top of the paper, and then it had a point system for every half hour of the day. Each half hour, the participant was able to earn up to 3 points, and if their behavior was poor, as low as 0 points. There was a reward at the end of the day, depending on the amount of points one received. The check-in, check-out sheet provided data for each day for the student, and to ensure there was a united front with the school and home, at the bottom of the sheet was a parent and guardian signature that the participant would need to get signed and brought back the next day. This provided great face validity because the participant was able to see where they were at throughout the day as the sheet sat on their desk with their goal in sight. Another type of documentation that was utilized for this evaluation was a program called Educator's Handbook. This program is being introduced in school settings and is used for the staff. In this program, it allows teachers and other staff to input any behaviors that have occurred. It lets them list the environment and setting, the possible antecedent or trigger, what was happening during the behavior, and lastly, the duration of the behavior. This was a great resource to utilize in this evaluation once the participants transitioned back to their general education classrooms, and I was unable to observe all the participants at once. The challenges that were made aware during the evaluation when I was trying to collect data was making it more complicated than it needed to be, meaning, instead of keeping data collection simple with duration at first, I was trying to collect ABC data on each individual student throughout each day, every day. In a behavior classroom, this proved to be a challenge with the amount of behaviors occurring in the day. The other challenge that made it self-aware was when I was unable to be there due to a sickness or other commitment around the school and was not able to collect data. Due to using the Google Sheet, it provided the opportunity for data collection to be taken amongst multiple different people. The evaluation design that I chose was the one group pre-post design. I'd come to the decision of this design because of not attaining a control group to be a part of this study. I conducted this study by having a baseline, an intervention, and then a return to baseline set of data. The participants in the study were being evaluated on if they had increased or decreased their duration of behavior after this classroom had concluded. The threats to internal validity were maturation of the students as they naturally mature within the school year and medication. Some students were on medication before they had started the behavior classroom, while others started new medication during, and then there were some that were completely unmedicated. This threat to internal validity was handled by talking with the parents and guardians and being aware prior to the student coming into the classroom if that may be a cause of their behavior. In using the one group pre-post design, I followed the program of 12 participants. I collected data from the baseline, which was 4 weeks prior to the intervention, which lasted 6 weeks, and the return to baseline or post-intervention that lasted 4 weeks. In this study, I analyzed the data of the duration of how long each behavior episode had lasted. I calculated the average minutes each participant had spent in a behavior episode. In doing so, I was able to create a column chart showing the average scores for each participant. The average minutes are shown by 2 different columns. If a participant does not have a second column, that means that their average minutes spent in a behavioral episode is 0, meaning after the behavior classroom program, they did not have a single outburst of behavior during their first 4 weeks post-intervention. I analyzed this data visually by the interocular trauma test. By doing this, I was able to determine a steady decrease in the duration of behavior. I also analyzed the data of this study by doing a paired t-test. By creating a paired t-test for the data I had collected, this would then prove if my study was statistically significant. After completing the paired t-test, it was received that the p-value equaled 0.0003. This proves that this behavior classroom program is statistically significant. When I used the numbers given in the t-test to find Cohen's d, I was then able to obtain the effect size of my study, which was negative 1.96, thus resulting in this study being practically significant. It answers the question of if the intervention group changes from the pre-intervention to post-intervention after they had participated in the behavior classroom. The group's baseline or pre-intervention average minutes for the behavioral episodes were 43.59 minutes. During their behavior classroom, the group's average was 18.93 minutes. Once the behavior classroom was completed, the average minutes of duration for behavior episodes was 13.14 minutes. In the following slides, charts of the measured data will be shown. These charts will depict how the behavior program made an impact on the duration of the participants' behavior. This chart is a visual data representation of average minutes that a participant was in their behavioral episode. As it has been stated in previous slides, this was done by a stopwatch while being present when the behavioral episode is occurring. The blue columns within this chart represent the baseline data that was taken prior to the behavior classroom. The orange columns represent the return to baseline or post-intervention data that was taken. The names within this chart have been changed due to confidentiality. This line chart depicts the data pattern through baseline to intervention to return to baseline or post-intervention. It proves a steady decrease in the average minutes spent as a whole for the behavioral classroom. The conclusions of my evaluation outcomes occurred as anticipated. The duration of the behavior episodes decreased at a steady rate throughout the intervention. It proved to be statistically significant as well as practically significant, and the use of the check-in, check-out intervention is still being utilized within my field placement on these particular students as well as others. It proved that many factors can be the cause of behaviors that include the environment and or setting the participant is in, the individual needs the participant has and requisites, the mood they are in on a current day, and their trauma history and home life. Being that there are many factors when it comes to behavior, it will always be unpredictable. Behavior is something that will constantly be changing, and there will never be a one intervention fits all technique. With that being said, when conducting this study, I made it a priority to work with the team at Hurricane Elementary School to ensure that we consistently reevaluated techniques and interventions being used. We had meetings focusing on certain participants in order to understand their needs and what interventions would be the best fit for them. It takes constant consideration in order to truly change the behavior. Understanding the threats to internal validity also made the team aware of other outlying factors that could make an impact on the data being received. Watching the participants, ranging from first grade to fifth grade, grow and learn different behavioral coping skills and techniques provided me with a level of comfort knowing that they will not only have a higher rate of productivity academically, but their emotional well-being will start to rise. When I do a study again, I want to have a higher level of preparedness to ensure that I can collect data the way that it is most effective and be more consistent with data collection. Depending on the nature of the study that I would complete, I would also want to return to the participants for a follow-up assessment a few months after the program had concluded. I have noticed since completing this evaluation, there has been spikes in behavior since after the return to baseline or post-intervention phase has ended. If I were to conduct this evaluation again, I would make a point to do a follow-up after 3 months to monitor where those participants are and if they are still retaining what was learned in the behavior classroom program. In conclusion, this behavior classroom deemed to be effective in decreasing the duration of the behavior episodes and thus resulting in an increase of general education classroom productivity. Thank you for listening.